Donna, thank you very much for your presentation. Tongue tie seems to be a well-known issue. How comes that you undertook new research in this field?
Well, besides it being well known, it's still rather controversial in certain areas of the world whether we should do a frenotomy to release the frenulum. And the reason for that was that breastfeeding was very low in the 70s. There weren't a lot of women breastfeeding, and therefore the effect of a tight frenulum or tongue tie was limited with bottle feeding. So it was thought to be absolutely unnecessary to do that procedure. However, when breastfeeding rates went up, then problems started to arise with tongue-tie babies, and then it was being identified that feeding problems were occurring. So we decided to carry out some objective research to show that when frenotomy was done, that milk transfer was improved, that the mothers experienced less pain, and that actually we could look at the tongue and the nipple in the baby's mouth and show that that procedure had normalised the movement much more closely to the term healthy infants without tongue tie that we'd studied before.
And you used new tools like ultrasound for this research. You used that earlier, didn't you?
Yes, we did. So we studied term infants without problems initially, and ultrasound has improved dramatically over the last 30 years. And in fact, I'm a sonographer by trade, if you like. So I brought that skill to our group, and it provides a window to the inside. Looking on the outside doesn't tell us a lot. So my way of looking at things was much more imaging and trying to measure and be objective about what we're seeing so that we could provide evidence using this technique.
Doctors apparently do not always recognize tongue tie. What is the effect of cutting it, and do you recommend now parents, mothers, fathers to look themselves whether something's wrong or not?
I think that first of all, first answer is that some tongue ties are very obvious. The type 1 or 2, or the ones that change the shape of the tongue, it's very obvious to most people. The ones that are further back in the mouth are much more difficult to diagnose. So that requires education and evidence to show that that type of tongue tie and frenulum does affect breastfeeding, and it resolves, the issues resolve when it's done. Certainly mothers breastfeed their babies at least 8 times a day. So mothers are quite aware when things aren't going right. And of course, mothers have access to the internet, for example, so they will look and they will see things that they think are tongue ties. The thing then is to go to a paediatrician or a GP and tell them about the concerns, and then hopefully they'll be referred on a pathway to resolve those issues.
And the last question, it's only a little thing to do this frenotomy.
Yes, in most cases the procedure can be done without anaesthetic under 4 months of age. After 4 months of age in our part of the world, the doctors prefer a general anaesthetic. However, it's relatively quick. The most difficult part of the procedure is wrapping the baby and keeping it still. Then it's a simple procedure of snipping the frenulum with a sharp pair of sterile scissors. There is very little bleeding, there may be some spots. The mother can breastfeed immediately. She doesn't have to be held. There's no anaesthetic. With a posterior tongue tie or something more complicated, it may require a little more work or an anaesthetic if the doctor deems it necessary.
Great, thank you very much.
No problem. Thank you.